Good morning, everybody, and welcome back to the Big Sky Business Insight Summit. We're thrilled to start our third of 3 days. It's been an extraordinary couple of days, and I think I was reminded again today when the case counts were presented in Montana of just how important this discussion is and how important so many of the industry leaders and institutional leaders are who have joined us these last 3 days. Yesterday, you may have noticed a conspicuous absence from our panel discussion. Dean French, the CEO of Community Medical Center, couldn't join us at the last minute because of the high case counts in Missoula and the struggle that they're having right now to just staff the hospital adequately with all that's going on. It was just a reminder to us, and with his blessing of sharing that news, that now is such an important time for us to be mindful of, thoughtful about, and doing everything we can to support one another, to bring everything we have to the table to help our community get through this, and to bring every amount of knowledge and expertise across every sector to find ways to move faster, to respond to this crisis effectively and wisely, so that we are a more resilient society and economy moving forward coming out of this. We would not be here today without tremendous help from our sponsors. I just want to thank again the Montana Bioscience Cluster Initiative, C2m Beta, powered by Blackfoot, the Governor's Office of Economic Development, Two Bear Capital, and the Montana Bioscience Alliance. We're grateful for all of the work you do in this field to really help lift up Montana, and especially grateful for your sponsorship in making this event possible. Day 3 is really intended to take a look at sort of where we are today and how we use the opportunities in front of us, and you know, frankly and intentionally use this crisis to make ourselves stronger going forward in the days and weeks ahead, but also to lay a groundwork for years ahead so that we're a stronger state in the future. I'm thrilled with the experience, talent, knowledge, and expertise that we brought to the table today. I think it's going to be a very rich conversation. One of the things that's been so extraordinary to watch from Missoula Economic Partnerships standpoint in terms of watching the Bioscience Cluster Initiative really try to nurture this industry and think about how to be more mindful in the future is to see some really, really immediate successes of new startups that are taking advantage of technology, taking advantage of the strengths that we've already talked about in terms of extraordinary people being here, and frankly, taking advantage of our biggest challenges, our remote locations, to bring things like telemedicine, to bring rapid testing to COVID, and to change the way that we think about doing medicine from being in a hospital to being on your phone. And I'm really excited to share with you a story through one of our sponsors, C2m Beta, powered by Blackfoot, and to present that story and talk about his own case as an entrepreneur and an expert in the medical field is Jeff Fee. Jeff, I'm hoping you can take a couple of minutes to tell us what you've been through and what a powerful experience starting up a tech company around healthcare in Montana has been, and how COVID has been a moment for you to sort of think differently about how you approach what you're up to. Thanks, Jeff.
Sure, and thanks, Grant. Great. So I spent 10 years running the Western Montana region for Providence Health and Services, and if you know anything about running a health system, there is nothing easy about running a health system. And I had this big, hairy, audacious goal to change the way healthcare was delivered in the communities that we served. And while we made incremental progress in terms of quality and access, fundamentally, we were not able to change anything in terms of the underlying structures of healthcare and specifically around the areas that need to change. And so after I left, I set out on another personal mission to continue that body of work, which is contributing to positive disruption in healthcare, and ended up joining a company and ended up coming on as the CEO for Patient One, which we do automated care management and remote patient monitoring. And I can tell you, being an entrepreneur and being in the startup world, I've decided that it's certainly a young person's sport. It's the hardest thing I've ever done. And I can tell you that we would not be where we are today if it hadn't been for the success. I mean, the infrastructure that we have in Missoula and in Montana, specifically around startups, is incredibly rich and is getting richer by the day. We were invited to join the C2m Accelerator. Joe and Jason invited us to come in. And we had already been through an accelerator down in Boomtown in Boulder, Colorado. And that's primarily just to get you ready to pitch. The accelerator that C2m has been put together around, which was more around how do you operationalize a startup. And the experience that we had with Blackfoot and with C2m really put us in a position to where we are today. I mean, we would not be where we are if we did not have that type of support. So I want to say thank you to C2m. It is and I would suggest that you reach out to Joe if you've got ideas that you think would benefit from being through an accelerator, especially one that's aimed at getting you up and running. It's definitely an experience that will benefit your organization as a whole. You know, we prior to COVID happening, we were having to spend 2 to 3 bounces with every one of our prospective clients, talking to them about what we did and educating them about what we did. And when COVID hit, who knew that remotely monitoring and managing patients in their homes had such good clinical and public health utility? So the awareness that this pandemic has created has significantly propelled our company. It's also giving us an opportunity to pivot into other use cases. We're currently live with 4 county health departments in the state of Montana, including Missoula and Lewis and Clark. But we're also live and going live with some pilots in Houston, Los Angeles, Detroit, Indianapolis, Cleveland, and Portland. And those are small pilots that are intended to grow significantly in the coming days. And so obviously being nimble and being in the startup community where you can be nimble has enabled us to be able to pivot and provide solutions to providers and hospitals and public health departments to help manage through this crisis. And again, I just want to say thanks to Jason and Joe with C2m and Blackfoot for all the support that they've given us to date. Thank you.
Thank you, Jeff. All of us at MEP are just thrilled and excited to see what's happening with Patient One. And I think it sounds like our medical providers who are using your tool are just grateful that that tool exists. Obviously, what we talked about the last couple of days is the startup culture as well as the long history here. Dr. Goodwin talked about his early startup days and the struggles that he had trying to find funding and chasing down venture capital from coast to coast. And it took so long to convince some of the people who invested in his companies that Montana was worth the investment. And once he did, people realized that we had science and technology and people here who were doing work as good as any place in the world. I think that continues to be true. And I think cases like Jeff show that we've continued to build a great ecosystem of support here to make that easier and easier for entrepreneurs to succeed in this space. And we're hoping to see more success stories like Dr. Goodwin's early success and more like Patient One to continue to thrive here. So our panel today is an extraordinary one, and our just a group of people who I'm super excited to hear from. But also our moderator today, Sean Becker, is somebody who, frankly, was sort of gave me the seed of the idea for this entire conference. And it was a conversation we had just maybe 2 weeks into the pandemic when we were racing to find people to provide supplies to hospitals and frontline workers and connect those who needed products with those who we thought might be able to pivot and deliver them. And it was then that Sean said to me, I think COVID-19 is going to be healthcare's 911. And this is going to change the way that we think about our industry and the way that we focus on healthcare and delivering and producing vaccines in our country, probably forever. And it was then that I realized this was potentially not just the biggest threat we've ever faced, but the biggest opportunity. And it was important to me to think about how do we pull our community of experts together to think about how we take advantage of that opportunity and put Montana in front of other places in terms of all of our thought leaders coming together to think about what we could do next. So I'm excited to have many of those thought leaders and innovators and industry leaders here today on the conversation, and to welcome Sean as our moderator to host that conversation and to really bring out tease out where this might be going and how we can use our strengths to be stronger in the long run. Sean Becker, thank you so much for joining us.
Thanks, Grant, for the generous introduction. Glad to be here today. This is a very exciting moment for many reasons. One is that we're also experiencing a peak in COVID. So our day jobs, and each of us have gotten quite busy with 700 new cases yesterday, 1,000 cases over the last 72 hours, 1,000 plus. It's been really an extraordinary time. And with that in mind, we really do have an extraordinary panel for you today with great stories on where they have been throughout the pandemic. People that have really been making a big difference, not just in our communities, but statewide, and really setting a leadership role and precedent nationwide. So what I'd like to do is have folks introduce themselves and tell us a little bit about who they are and where they've been through the pandemic. And I'll start with myself real briefly, in that I used to be an administrator of the Department of Commerce and worked with Missoula Economic Partnership and the economic development organizations across the state to help create jobs, build resilient economies, and grow the state's GDP. And with that, try to improve net wealth of the individuals across our great state. I've transitioned now and I work for the Montana Hospital Association, where I'm the vice president of shared services. And what that means is that I've been in the middle of the mix as it relates to workforce, supply chain, group purchasing, medical product distribution, and as well as insurance. And it's been probably the most important work I've ever done in my career. And that there were days in our office where there were many tears, and we knew that if we didn't get that next thing, lives could be lost. And we're facing that actually today with ventilators. And so it's a critical time. And because of groups like this, we've really made incredible headway across this state. And just for us to take a moment here today to pause on what we've accomplished and the potential opportunities going forward is really a great resource. And so glad that you can join us. So with that, I'd like to first introduce Bryce Ward.
I already talked, but if I have to introduce myself, I say I'm a genius economist and all-around swell guy. Of course, that's an oxymoron because there's no such thing as a genius economist. So through the pandemic, mostly I just lived through it. I don't actually work in healthcare, so I don't have to actually actively manage it. But I have been doing a lot on talking to people about what it's been doing to our economy and trying to think about what it means for us going forward.
Thanks, Bryce. Next, I'd like to introduce Shannon Lewis.
Good morning, and thanks so much for having me. I'm Shannon Lewis, and I'm the director of the State Workforce Innovation Board. And my COVID experience was, I think, a little different from where we were having conversations pre-COVID about how we train and recruit and retain people in an economy that is basically at full employment, resting around 3%, to immediately, of course, the Department of Labor going in and helping with a total UI response, assisting Montanans navigate a very uncertain terrain with significant job losses and a downturn in our economy. I think that was very eye-opening for me as to how many Montanans really are living right on that edge, talking to folks with $6 in a bank account and nothing on the horizon, which really, I think for me on the workforce development side, thinking about how do we take these folks that have had dislocations and whose lives have been disrupted, look at where people are at, and then talk holistically about how we re-employ and retrain people into meaningful work. And I think that definitely includes larger conversations about healthcare and, contact tracing and the public health response on how do we actually bridge that gap as an agency, which is certainly no small feat. But I'm really happy to be here. I think it's no surprise that, the Montana Department of Labor in a number of our efforts for years and years have focused on healthcare and how we get an adequate number of folks in these occupations throughout our state. So thanks for having me this morning. I look forward to participating on the panel.
Thanks, Shannon. Next, I'd like to introduce Dr. Chelsea Bodnar.
Hi, thanks, John. It's really nice to be here. I'd just like to contest the swell guy comment that Bryce made and have a chance for all of us to comment on that later. No, I'm a pediatrician originally from Montana and was lucky enough to move back almost 3 years ago now. And my engagement, I am a doctor, but I have not been in clinic during COVID because my work pre-COVID was about how we could build collaborative communities across the state of Montana. COVID, that community, we've been definitely watching what telemedicine and COVID can do. And it was interesting to be just before COVID and be very engaged in telemedicine because clearly that took a different accelerated moment. I think one of the most meaningful places we've been able to be as a community during COVID, and Sean and the MHA were able to be supportive of us in this moment, is our providers have been able to offer care to our Fort Peck community. in eastern Montana. And that's a place where, when we were there in March, there were no pediatricians able to connect remotely to that community and none living there. And we now have coming up on 15 pediatricians who know how to connect with that community, are invested in that community. And that has not always meant that the telemedicine visit was the cure-all. But what it means is that those of us who are living on this side of the state and are connected to our communities and these capacities are invested in that community's health. So we were able to call MHA when there was no PPE for the school-based nurses at Fort Peck. And literally someone got in the car and drove N95 masks out to eastern Montana. And I think that's what COVID can remind us about, is that we can maintain greater connection and collaboration, that we have capacity within our workforce, and that those are the strengths of Montana. So that's been the silver lining of the sort of our engagement.
Thanks, Chelsea. Next, I'd like to introduce Chris Booth.
Hi, I'm Chris Booth. I'm the CEO of Fire Diagnostics. I joined the company about 13 months ago. Fire Diagnostics originally started out identifying blood-based biomarkers for the diagnosis of various neurological disorders. And since then, the company has expanded into developing novel isothermal amplification technologies for the detection of these biomarkers that offer a more rapid, simple to use alternative to the traditional RT-PCR tests that are currently being used, including for COVID. And we focus on finding biomarkers and developing these technologies for various diseases, again, neurological disorders such as seizures or epilepsy, or Alzheimer's disease, as well as various cancers, to various applications in the agricultural industry. And we were actually working on applying one of these technologies to the detection of a bacteria in citrus trees right as COVID started. So as soon as COVID became a bigger and bigger thing, pretty quickly we realized we needed to try to apply what we were working on to offer a solution to the problem. And so we started working on developing our own test for the detection of the SARS-CoV-2 virus. We ran with it. We have quite an amazing team of very talented individuals that have pushed us across that line, and we have developed a novel rapid isothermal amplification technology for the detection of the virus that we are currently doing the studies for to get EUA approval. However, navigating this process, I'm sure as everybody on this meeting is aware, this has been a very dynamic environment, a very dynamic situation, and we've had to be very reactive to the situation going on. And developing a test is one thing, but actually deploying it and having it utilized in our community, because what we wanted to do is provide something to help our state. And it quickly became apparent that Montana needs more testing capabilities. And so we decided to, in parallel, build a clinical diagnostic testing lab alongside our research and development lab. We converted a part of our facility, got a ton of new equipment and capabilities so that we could offer high throughput automated COVID testing for the state of Montana, trying to remove the human element altogether. There's no human manipulation of pretty much anything in this whole process, and allowing us to be able to process and test as many samples in a given amount of time. And so we recently got that up and running and have gone live with collecting samples for COVID testing. And hopefully in the next month, we'll also finish getting EUA approval for our own tests so that we can start implementing our own diagnostic test, which is going to be able to increase our throughput because our test is significantly faster. It takes 30 minutes instead of an hour and a half to 2.5 hours that traditional RT-PCR takes, while offering an equivalent sensitivity and specificity. That's where we are today. We're going to keep chugging along. Things are about to get pretty crazy. So we're just going to stay focused on trying to do whatever we can to increase our testing capacity, because it's going to be needed right now and then in the near future. And especially as we get towards deployment of a vaccine, testing is not going to go away with a vaccine, because people are going to need to be tested before getting a vaccine. At least that's how it is likely going to be right now in the short term. So yeah, that's what we've been doing.
Thanks, Chris. Really groundbreaking technology. And then Liz Marchi.
Thank you so much, Sean, for being here today. I am the head of community engagement for 2Bear Capital, and I just want to send kudos to Chris Booth and the team at FIRE. I've had a seat at the table. They haven't slept a lot of nights since COVID started. And I'm lucky enough to work at a company, an organization and a firm that cares deeply about community. So when COVID hit, everybody, all hands on deck to see what we can do for Montana. And after 20 years of angel investing, it's really an amazing opportunity for me to see a tier 1 venture firm launched in Montana around life sciences. We have a stellar team of lots of PhDs who spent lots of time in school. Bryce, I think you noted yesterday that 2% of the population is employed in life sciences, and I can tell you why. They're about the smartest people I've ever seen in my life, and they work really hard. So COVID for 2Bear Capital has been a full court press on all fronts. Where our portfolio companies, Inimmune and Missoula and FIRE both have been right on the forefront of both testing and looking for a vaccine. So it's an extraordinary joy and pleasure, I think, that we have this kind of capacity now in Montana. And I'm just pleased to see 2Bear Capital kind of round out our ecosystem. We do have a great legacy of life science leaders in our country. And I'm just so happy to see people like Chelsea coming back and started companies. And I'm so excited to be in a top tier firm that launched from day one with half men and half women, which is pretty extraordinary.
Thank you all. So I think from what we see is that we all had our hand on a different part of the elephant. I think some of us may be looking more towards the future, and some have been down in the trenches. And I don't think Chris has slept since March 15th. And it's been really remarkable to see how folks have really adjusted through the pandemic. And one of the things is that there's some emerging technologies that were coming to fruition, but we really didn't use. And one of them is on the platform we're on, and the daily use of Zoom. And everybody from kindergarten through age 100 now is using some sort of digital platform to communicate, and as well as what's happened with telemedicine. And in your experience, have you guys seen some changes in the adoption or advancement of technology that you think might become permanent post-pandemic?
Well, I certainly hope so, Sean. As somebody who drives for 20 years, has driven between 30 and 40,000 miles in the state, just like I'm sure all of you do. I think we have a huge opportunity here to close the geographic divide that we have in an enormous place like Montana, and to come up with technologies. What I'm excited about is looking at the virtual lab and how we can collaborate together and actually do, lab work. But actually, we have been forced to do something that I think long-term will change our lives for the better.
Yeah, so maybe not as much interpersonal connectivity, but more technology-based connectivity that's really advanced. And on that note, the work that Chelsea, that you've been doing.
Yeah, I think it's an interesting question. Pre-COVID, we spent a lot of time in conversations with our physicians around a persuasion that good doctors do telemedicine too. A lot of time presenting clinical data to show safety and efficacy of video conferencing, because it's a little like saying to a physician, I know you learned how to do this job and you worked really hard to learn it, but how would you feel about doing it with your hands tied behind your back? Would that be fun? And I think as long as that's a scary proposition for a good doctor, right? And so I think the thing that has shifted during COVID has been there was no choice, right? If you were going to maintain a practice and maintain connection, you were going to give it a shot. And we felt excited that our community had a huge leg up because they had been introduced to this, they had more advanced tools, and they were able to sort of more comfortably dive into this. And we saw that in trending comfort with telemedicine. I think the challenge is I think what you're hearing from Liz and what we all understand is that as a patient, this is great. I don't have to drive. I can connect. The world of who I could connect with has opened up. it's maintaining the provider incentive, the provider payment models, the workflow solutions that are specific to medicine, and making it something that feels safe, feasible, and appropriately rewarded. Because I think what we've also seen is that even as COVID has gone up, as sort of official lockdowns have ended, telemedicine has gone down. And that's been primarily, I think, as Bryce would say, a supply side issue, not a demand side issue. It's not that people said, I'm not interested in not driving to the doctor's office anymore. It just wasn't made easy enough. So I think COVID opened the door. I think it brought a lot of people a lot farther where we need them to be. But it also revealed, as everyone who's ever started something new or tried something new knows, it revealed that it's not always easy the first time. We need better ways of sending emails and connecting and giving people codes and making sure it feels secure. We need to get more sophisticated about what tools we offer for people at home and have that be driven by the physicians that we need to do the work and not necessarily just the technology that is available, because sometimes those haven't been developed in concert with one another. So it's been so exciting. And I think we've seen a ton of meaningful clinical interaction that reinforces for physicians how important it is to serve patients where they are. And I think the work going forward is to make sure that we don't just assume it is solved, and we continue to make it a clinically rigorous, locally driven opportunity, because the other risk is that Montanans decide this was cool but kind of hard and we don't know if we're going to continue doing this. But those outside of Montana run with this opportunity and use the adoption of remote care to deliver into our state competitive opportunities that may not be as high of quality and really run the risk of degrading our fragile primary care ecosystem.
I think one of the people that we're missing from this panel is a regulator or a legislator. As I say that, I think that good policy is from the ground up, and it originates from the people that are on the front lines of our economy actually doing the work. With that in mind, Shannon, there's been some changes in your world. I mean, you went from a effectively 0% unemployment rate to quadruple digit. It seemed like I don't even remember what the actual percentage was, but I think we were closer to 30% at one point. But what has changed in the regulatory work that you do in terms of, how credentialed workforce are being onboarded, how you're working with the youth system, what you're doing for on-the-job training? I mean, how has that shifted?
I would love to attribute a lot of those changes, particularly in these higher skilled occupations, to COVID. But the fact of the matter is, because of the work that our providers, our healthcare community associations like Montana Hospital Association have done, we were making strong inroads into meeting some of our occupational demand on this side of the house for some time. In the state of Montana, we actually are leading in the nation on our healthcare apprenticeship side. So not every occupation is, of course, going to qualify for an apprenticeship model. But when you look at the whole umbrella of what falls under these kind of healthcare facilities and how we provide care throughout our state, there are a number of occupations that are either specialized. I think about the TBI specific apprenticeships that we were running down in Gallatin County to support folks who were being served in-house that suffered from traumatic brain injury and concussion care. These are specialized apprenticeships that are designed just for that work. In addition to that, I also wrote the state plan for workforce and talent development. Where we've seen significant progress in our state is the alignment between education and workforce systems with employer buy-in and into those fields. So when we're talking about healthcare and we're talking about how do we get people, or in the sciences, into the work that Chris is doing, this is different than taking someone like where we have on our unemployment pool now who's unemployed or underemployed and trying to figure out how to get them up the ladder. We actually need to start that career exploration much earlier, because many of these occupations, while some are apprenticeable, they're still going to have significant education components. And that's where we align with our university system and our K-12 system. They can't be designed in a vacuum. These aren't one-off certificates. These are things that require licensure. So we have had a lot of success working with our licensing boards on where do we see occupations that are ripe for apprenticeship where we can still pass licensure and meet those education components with our higher ed folks. We saw that alignment on the Perkins 5 side, which is career and technical education, and we've done significant work through like HOSA programs where they're able to take students who are sometimes, if you look in Billings, they'll be graduating from high school with also a CNA. And how do you build onto that CNA and help, move people up that career ladder? Things that we work on with the Hospital Association, Heather O'Hara has been phenomenal, I think, coming particularly off of the licensing board, serving on the nursing board, on taking a look at how do we do more? Because when you're looking, it's not just Montana that is looking at significant shortages in healthcare in all of the occupations. It's global. If you are an RN right now and you are good at your job, you can work anywhere in the world. So how do we compete in a state like Montana? And then how do we also ensure that there's equity for our rural hospital systems where service models are different? I think that we are seeing changes. The legislature is very engaged in this. How do we build those pipelines? But like I said, we've seen successes, but there's no shortage of room to grow. And we continue to be at the table and building bigger tables. Workforce and education have to happen and hand in hand with industry and with economic development. So when Chris and we have, any of our entrepreneurs who are coming into our state that Liz is engaged with, and we want to support this work, how do we have those conversations on how to ensure you're going to be able to build that workforce? How do you engage with K-12 systems? How do you engage with your 2-year and community college systems to help build your talent pool? So I've got all the solutions ready to talk for hours and hours, but it's all about collaboration. And like Chelsea said, it is really about how do we work that are within communities, because Lewistown looks different than Missoula, looks different than Glendive, and all of those communities have to kind of have a full-blown approach to talent development for any occupation in those communities, including healthcare.
And Shannon, kudos to you for being such a good partner. I don't know if you know that Two Bear Capital has been a huge supporter of the Youth Entrepreneurship Program, which we've deployed through the career and technical education teachers. And in fact, Two Bear Capital is underwriting the technology platform that the CTE teachers will be able to use this year because they'll have to have their first virtual conference. So I'm a big believer in you can't be what you can't see. So it's it's so important to build those collaborations between, venture capital all the way down to education.
I want to come back to Bryce here in a second, because Bryce, I think you're going to wrap it up for us on some of the market trends and dynamics and the supply and demand side of what's going on here, and then also what changes maybe in regulation and how to free up markets. But before we get to that, I want to go back to Chris. And Chris, your organization now, and the size it is, maybe a 10-person organization or so definitely a very small business. I mean, how would you see Fire Diagnostics become a 1,000-person employer in Montana or a 100-person employer? What do you need, and what steps would you take in order to get to that?
That's a good question. I mean, to be blunt, to get to a scale of that size at this moment, we have to reach outside of the state. We're going to have to bring people from outside of the state here to get people that have the backgrounds, qualifications that we need to be able to do what we do every day. We also want to start interacting more with the universities to be able to try to, outreach to try to get interest from students who may be exiting bachelor's degrees, master's degrees, or PhDs that there is job opportunity here. If you're interested in doing this type of research, or now we actually have a clinical lab, there's a whole different direction you can take, actually trying to interact with universities more. And we were a 2-person company, a 3-person company a little over a year ago. And so we've rapidly grown. And if COVID hadn't have happened, that would definitely have been something that we would have been pursuing a lot more strongly earlier this year. But COVID happened and it kind of redirected our focus a little bit. But what we've also learned is as we have a clinical diagnostic lab, I mean, there's a whole other avenue for people to take that maybe don't want to pursue more of a research and development side of things and just kind of want a more of a trade skill where they become a clinical technologist and can come and run clinical diagnostic tests for the local clinics and hospitals in the state. And that requires certain education requirements, certain work experience requirements, which are pretty strict, especially if you're going to do high complexity testing, which all COVID testing right now is essentially high complexity except for a handful of tests. And there really isn't a great path forward for getting that type of certification in this state. And so we actually right now are building a training program so that we can get people who have the necessary educational requirements to come to us, and we'll give them the educational materials and the work experience they need to check off the rest of the boxes, get the certification, get licensed, and have a job opportunity. And so we're putting that training program together right now, and hopefully that's going to be able to help us, our community and the state of Montana, have more people to be able to run these type of tests where we can bring testing to Montana instead of outsourcing everything.
Yeah, my head's spinning of all the ways that we could kind of plug in the pieces to help make that happen. Think about the market dynamics and what's happening across the country. And people now know what PCR means. People know what an antigen test is. Like these terms that 6 months ago nobody knew about, and how Chris Booth, the CEO of Fire Diagnostics, could kind of become a local celebrity as a science geek. Like what's going on, and for you to continue to grow Fire Diagnostics, and as a country, what dynamics do you see happening? Is now, like, as part of the immunization process, we're going to see more actual antigen and PCR testing for students to go back to school, and for employers, and for people to travel, airport and travel requirements. Do you see some trend line there?
I want to see it. I think it's there, but not consistently enough across this country. There's holes across this country to make widespread implementation of PCR antigen testing to become a part of our daily routines, travel, school, because this is also something that's going to be a little bit more long term. And come a vaccine next summer, this isn't over. We don't know. It could be another year and a half. It could be longer. This could become a seasonal thing, and we might have to implement this infrastructure across our country in a uniformed way that this just becomes normal. You have to, you're going to get routinely tested while you're at university. You're going to have some kind of test when you enter a new state or you travel. I think that is entirely possible. And it's something that I think we're going to need to go towards. And I think that companies like what we're trying to do right now are across the country are going to be required to be able to facilitate that. I think we proved that we had a broken system as far as testing goes by relying on two major corporations, and it broke and people panicked, and then there were shortages of everything. And I think one of the ways that we can move away from that is having more local testing abilities, so that you can, if you have a couple companies in your state, especially in like the state of Montana, we don't have that many people, you could support your healthcare system by offering those tests. We've already talked to hospitals about how they have post-COVID, they have problems getting test results in a timely manner for a reasonable price for standard things. They have to outsource it to all the other places, and they would rather send it to a company in the same state, and even if it's the same price, and get a little bit quicker of a turnaround time, and also support the local economy. Yeah, I do see that a trend line towards changing how we do testing in this country. I think it's inevitable at this point. Exactly how that looks is kind of hard to say. I think the local testing solution is one potential strategy that we'll see more prevalence in.
While you're talking, I've had two notices pop up on my screen. One was that Fire Diagnostics announces new large-scale COVID-19 test processing. Congratulations.
Thank you.
The second one was that Montana adds 615 new COVID-19 cases. We continue to approach 6,000 cases, which is the second highest day ever. So as this is being recorded, we're kind of at a peak in terms of the infection rate on R0. We're the second highest in the country right now. And we're seeing peak cases as well as hospitalizations. This is going to have some impact for quite some time. And Bryce, I kind of want to bring it back around to you. You've heard from everybody on this panel, and There's function of regulatory. We've seen changes in how regulatory barriers have been broken down, and maybe those will be permanent. And we'd like to hear your perspective on, like, from a regulation perspective, has there been too much in health and life sciences and biosciences? And now we're seeing a freeing up of that, and that should that be permanent? And then long term, like the healthcare industry, according to the last Labor Day report that was issued from the Department of Labor and Industry, is the largest private employer in the state. It's often the largest employer in every county, and is projected to grow by 1,000 employees per year, of which a fraction of we could provide organically through the existing apprenticeship use system and other ways of building a workforce. And so we're seeing a major shift here in what was projected to be a massive part of our economy. So on the supply and demand side and the regulatory side, what does the future look like according to your crystal ball, Bryce?
Oh, I have no idea what the future looks like. I have a magic 8 ball over there. I can go ask it if you want to know what the future looks like. But, look, things are going to change. Whether the regulatory, what's going to happen with regulation, I'm not a legislator. I don't get to make those calls. I don't actually work in the government, so I don't get to decide. You're always going to face the trade-off between, why does the regulation exist in the first place? Usually there's some reason why it's been put into place. And so you got to weigh those benefits against the cost, just like you always do, right? In terms of, there's benefits from not having regulation, but there's cost, and that people like to take advantage of things when there's not a rule against it. And that can be dangerous, particularly in healthcare. So, right now we can enjoy the Wild West while it exists, but, the Wild West went away for reasons. And so, that's ultimately what happens with regulation is you've got benefits and costs that got to be weighed, and the regulators and the legislators will have to revisit that, maybe what we learn is, okay, you can do that in this way under these circumstances, so we can write the rules a little bit differently on that. In terms of just, how do we create more capacity? Capacity has multiple parts. There's physical infrastructure. So, Chris has to go and buy new machines. He needs buildings and means to, internet and all that kind of stuff. And then there's, human, capital capacity. That's our skills in the workforce and all that kind of stuff that we're trying to create through training, but also through recruiting people to come live in the great state of Montana and take advantage of our quality of life. But there's also the social connections, the social capital that ties us all together. And, we have to continue to invest in building all of those things. And, obviously we don't have unlimited resources to do that. So again, we face trade-offs. And so, what COVID does is it's a shock to demand in terms of we now realize that maybe we want to do some things locally. We don't want to outsource them. So, we want what's called import substitution. We want to develop our capacity to serve our local markets. But we also are sitting here saying, well, look, we want Montana to be the place that serves the rest of the world, or at least the region or other parts of the country. And so we've got to identify where we think we can compete, where we, going back to my talk on Tuesday, what seeds are actually likely to land and germinate and do well here. And so that we can make sure that they have the resources that they need to grow and thrive and create new seeds and new businesses, because that's ultimately what it takes to get to having a big cluster.
Do you see any particular barriers to the fertilization in Montana for those seeds to bear fruit?
Look, Montana has two big problems. One, we're isolated. That's the biggest problem, right? We're not well connected to all other markets. Now, the thing about COVID and, this new technology that we're all becoming more conversant in and familiar with is hopefully that reduces the cost of isolation. But similarly, the fact that we've invested a lot in air service and internet and all of these things that help reduce those barriers, allow Montana companies to be more integrated into other markets, both as a supplier, so, meet the demand elsewhere, but also be more integrated in labor markets and have people be more aware that they can come here and live and not feel like they've moved to the end of the world. All of that stuff helps us, kind of become more integrated. And I had another point, but I have forgotten it in my long rambling answer.
We do have a couple questions, and we're hoping that we can touch on a few of these. One of the questions from Ryan Castonia is that looking into the future and given everything we learned so far, how do we better prepare for the next pandemic? And I think there's going to be some difference in perspective of, is there a next, or is there always an anticipation of a pandemic on our horizon? So how do we better prepare?
I was in Oregon. I was on mission that was trying to help Oregon prepare for the big earthquake. And look, it's really hard, right? The scientists can tell us this is going to happen at some point, but they don't tell us when it's going to happen. And so as long as they don't tell us when it's going to happen, we like to ignore that it's going to happen. And so we tend to, there's going to be an underinvestment. Now, the hope is that because we've just lived through this one, it will be the impetus for us to do what we should have been doing in this pandemic, which was, we already have the playbook and we pull it off the shelf. And we've actually been making sure that we have all the resources that make sure that that playbook operates. And we kind of know this is what happens and this is how how you implement the strategy. So, hopefully we make the investment in, the public health infrastructure and everything else that goes around it so that we are in fact prepared. But it's going to be a heavy lift because people will forget quickly because we don't like to prepare for things that we don't know are going to happen.
That's, it's interesting where Grant was referring to a conversation we had back on March 15th when the state of emergency was first declared. One of the grievances I had in that conversation was the rollback that we've had on innovation and technology on the government-sponsored funding to get businesses over the valley of death. We've seen less investment in SBIR. We saw the elimination of the Board of Research and Commercialization. We've seen that the eligibility for high tech has been rolled back in existing programs. And then we wonder today, where are the innovators? Where are the Chris Booths in the world? And so, Chris, you were going to respond earlier to the question on how do we better prepare?
Yeah, obviously I have a little bit of a different perspective from Bryce's, but I'm very focused on the technology and the science and everything like that. But from a practical standpoint, kind of to mirror what Bryce was saying, it's hard to 100% predict exactly, even learning from what we're doing right now, predict exactly what we need to do the next time around, because there could be new problems. A different virus could affect us in a totally different way and, break all the rules that we've tried to implement this time around. But I do think that from our experience that we've had in the past, however many months it's been, I've lost track of time. There are a few things that I think that we can collectively do better as a community and a state and a country. Obviously at the nationwide, there could be a lot better of a uniform response and support from all the way up to the top. But if, just trying to think about Montana, we've run into a lot of issues trying to break down barriers between the public and private sector, between the state and a private entity. There's a lot of rules in place that pre-COVID make it very difficult, or it actually not even allowed to do something with a private entity such as testing. Understandable 99% of the time, but there needs to be a point where there's that state of emergency, pandemic situations here. We might need to have a backup plan, where the typical rules maybe no longer apply. We need to just quickly break down those barriers in order to be able to better rapidly respond. We've had conversations with certain organizations that have taken months and months to try to get through red tape and still haven't in a lot of situations. That's not going to work in a rapid response situation for a pandemic. And I think another thing that we've really have identified as kind of a general problem, and this is not just applicable to the state, but is communication between different silos working in response to the pandemic. You can talk to one person at DPHHS and hear that you need to report results this way. You talk to the public health officials at the county level, they say do something else, and then you can call back to the DPHHS 2 weeks later and it's all changed. Why, where is this there's a huge communication breakdown between all of the different groups working in this, and understandably so. We're trying to all do everything that we can to properly and rapidly respond to this crisis. There's going to be holes, but knowing that now, I think in the future, trying to figure out some kind of actionable plan to make sure that all of these different organizations are constantly up to speed, and that when something does change, it trickles across all of these places, or maybe more uniformity in how certain things are done. And I think that's something that we could learn from what's going on right now, because it's still happening to this day. Almost every single day we run into these situations where it's like you hear one thing from one person, something else from a different person. What are we supposed to do? Do I call 911? Do I fax something to this person? Do I need to report this? And it's like, I need a straight answer, because we need to make sure that we're doing what we're doing correctly. And it almost seems like it's impossible to get that information. And I think that's, everyone, and it's not a failure of anybody doing anything wrong. It's just that we're all trying to do our best, but we don't have the systems in place to make sure we're all doing our best kind of together, I think. So I think that's something that we could maybe do next time.
You really nailed it there on improving alignment across both state and commercial organizations to be able to address the most emerging needs in any economy or situation. And I was detailed to the Department of Military Affairs to work under the emergency support functions, the State Emergency Coordinating Center through the pandemic. And I'd say that those are some of the most capable, outward-facing, motivated people that I've had the opportunity to work with in my career. Really amazing people that were adjusting policies, procedures, how regulation was moving through. It was jumping chain of command straight to the governor, how PPE and equipment was being addressed. Those policies were being shifted based on the marketplace. So more rapid change in government than probably ever. But what happened was when you pick up the phone one day, you call somebody like, no, that was like 4 hours ago. Now we're on to something else. You have to do this. And so hopefully, we have some muscle memory from that experience, and that the new emergency support functions that are created post-pandemic will reflect the ability to be much more agile and have central communication channels, of which they did build on the State Emergency Coordinating Center, the SECC, which was right under General Quinn. Right there in the hub of the governor's office and chief medical officer for the state. So, by the time the pandemic's done, we're really going to have this thing nailed. So we had a couple other questions come in, and Dr. Bodnar, I'd like to direct one of them to you. The question is, you've been involved in not just expanding telemedicine, but expanding provider connection through technology. What advice could you give life science experts across the state to adopt innovative ways to stay connected after COVID?
Well, have I got a platform for them? It's a great question. I think what COVID has let us do is put a different mission in front of us and unify ourselves around that. And not just in Montana. I Zoom with my friends from different phases of my training, and I have a friend who's in Michigan doing COVID work, and we just marveled at competitive hospitals in her region who would never would data cross a line, never would communication. We're actually coordinating which patients should go where, and how to keep people safe, and whose expertise. A level of complete logic and efficiency that you would never normally see. And I'm pretty sure that in that city in Michigan, everyone will revert back to their corners as soon as we don't have a shared mission. But I think Montana has an opportunity, because we have so few people, to realize that in a geography-lifted healthcare environment, it actually is the competitive advantage for us to maintain connection to one another. And so I think the fundamentals are continue to look for the peers who are your knowledge base or your intellectual or your capacity peers across the state, and where you may have defined them as competition, start to think of them as possible collaborators. And I think the other thing that we can do there is ironically overlay your potential to work with one another with this remote work possibility, where isolation has given us new ways to be connected. And I think in terms of ways of working with one another, where we used to think we needed to sit in the same conference room in order to work together, we realize maybe we don't need to do that. And so look for those peers who maybe are isolated for other reasons other than you could have been the best of partners. Use remote work as a way to lift geography in a positive way. And then even if COVID isn't our doesn't maintain our mission as doesn't give us a unified mission. For those of us who deliver care, I think continue to redefine our shared mission, which is the health of Montanans. And if we can continue to put a shared mission at the forefront, I believe our innovative spirit and our shared goals can create a really novel and amazing future for the way we deliver healthcare. And I think can actually not only find efficiencies within our own systems, but to the point that I think Chris and Bryce and others have made around, we can be as efficient as we want. We still need more people to help us. We need both efficiencies and increased supply of providers. Creative ways of delivering care will become a way to attract more people because it will be a unique place to participate in being a physician, being a provider, being anyone who works in healthcare. So those would be my principles and my hope.
Liz, Marchi, as a technologist and a financier, and we know that how markets move is really where money moves. Where do you think that you're going to be putting your dollars in the future based on what you've learned through the pandemic?
We're going to be putting our money in diagnostics, bioinformatics, so that we can really understand the technology of the human body. I mean, that's where we're going. But markets go where customers go. And so one of our goals is to do things that really massively move the needle for better health and wellness. I'm an aging populationer, and I'm right in the middle of the baby boom. And I think customers are changing. They're aging. They're living longer. We know dementia is going to be a huge impact. So neurology, that's an area that I think we'll be putting, a lot of resources into going forward. But things that really massively deliver better results to patients. Because I think that is the shared mission, is the health and wellness of patients and people.
Could you explain bioinformatics to us?
So think of genetics. We used to think that the DNA, the Human Genome Project, we actually thought we sort of understood the human body. Now we sort of know that that's only about 2.5% of the human body. So all of these other things, and believe me, I am the armchair scientist in this group. I read day and night, but I'm sort of your average Joe on the street when it comes to this. But all of our immune system, proteins, all the things that regulate our genetics and turn them on and off are profoundly complicated and have infinite combinations. So when we talk about diagnostics, precision medicine, we're going to look back at big pharma someday, and because we're creating in a black box right now, we know it works, but we don't really understand how. So bioinformatics will eventually give us that set of data and the tools that we need to analyze your body, Sean Becker, so that we know, gene 12-2E is really what's giving you migraine headaches. And so while Advil may work, there may be something else personalized for you. So personalized medicine will be enabled by bioinformatics and understanding genetics.
In University of Montana, is not on the panel, but has been on other panels, is really doubling down in that space as well. And their Center for Precision Medicine and a lot of aspirational goals there, but really remarkable area of science.
Well, both on precision and the predictive side. That's the other really exciting thing, is being able from very early on to, and you'll have sort of your footprint, if you will, and then it plays into all these areas of security, which is another area that we're really interested in, is how do we guarantee your privacy and security when we know every genetic footprint of every human is different. So the ability to predict disease allows us to then do early intervention so that both you're healthier and, frankly, it saves hundreds of millions of dollars in the health system.
So one of the questions that's come across in the Q&A board is directed to Chris, but I really think it applies to each of us. And the question is, do you have the infrastructure to grow? And there may be a follow-up question to that if we don't, what is that? What do we need to grow Montana's economy in the spaces that you point out, Liz, and the areas that you're working, Chris, and Chelsea, what you were talking about in the connectivity and competitive advantage of maintaining connection?
Yeah, so I can address the testing side of that specifically. We have spent a lot of time and effort learning what's out there, what are people doing, what works, what doesn't work. As far as testing goes, sample collection, what are the best reagents? What are the best strategies for all of this? And we've taken all that information and distilled it down into what we have implemented. And with 100% in mind, keeping in mind scalability, we call them pods. We created these cluster of equipment that we're calling pods that you could basically, as long as you duplicate the pod, double your capacity. Duplicate the pod, double your capacity. You could implement it somewhere else because there is a physical space limit. I only have so much space to put stuff in our lab, to be honest. So, I mean, there's one limitation there as far as scaling. We did just move into the basement of our building, so we have a whole new footprint, but there's definitely scalability with what we're personally implementing to a very high degree. One of the biggest bottlenecks is supply and personnel. And supply is something that we have been able to address. We made sure that what we were implementing, we wouldn't run into supply issues, all the way from sample collection and swabs to running the tests. We made sure to pick things where we knew the manufacturers had responded to the supply issue and have fixed it. So, we can get swabs whenever we want, as many as we need. We can all the way to all of the testing reagents, making sure there's no bottlenecks there. Personnel, though, is something that's really, really, really hard to fix. Getting people who are experienced in doing high complexity testing and implementing, also feeling comfortable handling infectious. I mean, we use a collection media that inactivates the virus, but I mean, it's still it's just a perception thing. It's hard finding people to go into the lab and work around the clock to implement what we've developed is probably right now going to be our biggest hurdle. High throughput enables us to produce a result very, very quickly, but to get to a capacity that is thousands and thousands a day, that limitation is really going to come down to personnel, because we can get equipment and we can get the supplies, but we need bodies that are actually going to be able to do what we need them to do. We've tried to remove all the human elements and everything, but it's still high complexity testing and you need people who have that experience. That's hard to come by right now. That's why we developed our training program. We're developing our training program so we can, because this isn't going away in a month. So, 6 months from now, yes, Shannon, I took a note that I need to get in touch with you.
So Sean and all of you as panelists, a great conversation, far ranging and really informative. I appreciate what you had to say. I'm excited to carry some of these ideas and thoughts forward into our fireside chat, Sean, in a few minutes. Just thank you all so much for your time today. Thank you for sharing your experience and expertise, and frankly, your passion for Montana. We are lucky to have all of you here, and I'm excited about the future for Montana, knowing that you are all here to help us shape what that looks like. We appreciate your time today.